What are the benefits? Why would a person bother going through all this work to have a dental implant? You know, why not just have a denture? We talked about some of the pitfalls of dentures, but we'll go through this in a little more detail. Number one of the biggest problems we have with our teeth, especially when we're young, is we get cavities. Implants are not made of natural substance. They're metal, they're titanium, so they don't decay. Doesn't mean we should go on a chocoholic diet or throw away toothbrushes, but it does mean that people who've had a battle throughout their lives with tooth decay and have had, you know, cavity after cavity, filling after filling, then infection, and root canal, then crown, and so on and so forth, and eventually losing the tooth after all those things, put an implant in place, they don't have to worry about cavities anymore, at least not on that implant. Oftentimes people also lose their teeth because of gum disease. And with natural teeth, the bone is attached to the teeth a little bit differently. There is a socket of bone, but there's soft tissue, there's ligaments that basically suspend that tooth in place. And gum disease is a progression of bacteria around that little space, and it causes bone to be lost. And some people have a real challenge and real battle with gum disease, and they end up slowly losing their teeth. Well, if those teeth are removed, once the teeth are removed, the gum disease is gone, because that whole soft tissue around the tooth is also gone. It doesn't exist anymore, and as a simple explanation. And so you have an implant put in place, you get a brand new start. The bone is actually fused to the implant, and you don't have that same soft tissue attachment with ligaments around an implant as you do with a natural tooth. So you do get a brand new start. People who've had gum disease can have their teeth removed, have implants in place, and now that gum disease that was in that area or in the mouth is now gone. It doesn't mean they can't lose bone around that implant, but it's a different process, and it has more to do with function and too much function and under-engineering of the implants than it does some of the other factors that affects gum disease. The other advantage of an implant is you don't have to drill the natural teeth down. Before implants were available, one of the best ways we could replace teeth was with something that we called a bridge. And a bridge involves putting a support on a tooth on this side and a support on this tooth on this side. Basically a crown, or typically a crown. And in the middle there were false teeth. So in order to get a crown on this tooth and a crown on this tooth, we had to take these teeth on both sides and drill them down. And if the teeth need crowns anyways, well, then that's maybe not such a bad thing. But if they're perfectly intact teeth, we have to drill them down. And here's an example here I'm going to show you. If I lift this off, you can see how these teeth have been drilled down in order to accept a bridge. This is 3 teeth joined together with a crown on each side and a false tooth in the middle. And this gets put over top and gets cemented into place. And it's been around since the turn of the last century, I should say. So it works very, very well. But it does mean we have to take these teeth, we have to drill them down. It makes it more difficult to floss around these teeth. It makes them more prone to decay if we're not flossing around them, and it makes them more prone to gum disease also if we're not flossing around them. And plus, if anything happens to any one of these teeth, this entire bridge fails. If something fractures, something breaks, something gets a cavity on it, the entire bridge can fail. So bridges are excellent, but in my opinion, implants are a better alternative in many cases. We talked about decay, and of course, as you see in this slide, that's one of the major reasons for bridges to fail. In fact, crowns and bridges, we get them in place. Studies show that 15 to 20% of them will fail in the first 10 years, usually due to decay, gum disease, or fracture of the tooth underneath. If we're missing a few teeth, the teeth start to move and start to shift. If we can put an implant in place, it basically will help to stabilize those. It also helps to distribute the forces. So some teeth that might be loose or becoming loose because there's excessive forces on them, it can help to stabilize those teeth so that they're much stronger and tighter, and they will not be being pushed around and being loosened up. Our ability to chew is increased, especially if we're going from a denture to something that is permanent, teeth, or even something that holds a denture in place. If we can chew our food better, of course our digestion is better. And as we get older, where digestive enzymes are not as abundant or not as effective, it's all the more important that we chew our food well. Titanium is unique in that the bone will grow against it. It's also very biocompatible. Although some people have got some issues with certain metals, nickel is one of the most common. About 5% of the population have a nickel allergy. In all the years and the millions of implants have been placed, there have been no true allergies reported, and generally, majority of people do very well with titanium implants. The other thing that happens, and we talked about this a little bit in one of the earlier video series, is our bite force changes. The average bite force is anywhere from about 50 to 200-300 pounds per square inch, and that's the pressure we put on our food when we bite through foods, whether soft or hard. When we can clench with up to 500 to well over 1,000 pounds per square inch. But researchers have done studies on this, and when we have lost all our teeth, or pretty much all our teeth, our bite force is decreased. Our ability to bite with a full lower denture can be as little as 20 to 25 pounds per square inch, but quite commonly it's down to 5 to 10, especially in the lower arch. So you can imagine if you have something like this and you're only biting with 5 to 10 pounds per square inch, and the person beside you is biting 50 to 100, 200-300 pounds per square inch because they've got their natural teeth, it's going to be very difficult for you to chew your food. It's going to take you very long to chew your food, and you're just going to basically avoid certain foods because it's just too difficult. But what happens when we lose teeth? We lose the bone. And if we have teeth, it maintains the bone. An implant works very similar. If we have an implant in place, that implant is placed within the bone, and as we bite down on it, put pressure on it, it stimulates the bone, it exercises the bone, so that bone volume is maintained. If the bone has already been lost, that bone will not grow back by putting an implant in place. However, it will at least maintain the volume so you don't lose any more bone from there on. In my opinion, also, implants are very easy to maintain. They don't collect as much plaque or tartar as they do with natural teeth. And our success rate is phenomenal today. If you remember in our earlier slide, we had about 80% to 90% success rate in the upper and lower jaw respectively. Today we get about 98% up to even 99.3% depending on which study you look at with dental implants. And this is after 10 years. This is not right away. So this is after 10 years. And why do we have much more success rate today? Well, we understand bone physiology better. We understand why the implants, or I should say, what helps them to fuse to the surface of the implant, and we understand better bone physiology and also the forces placed on the implant and how to distribute the forces over the implant so that the bone is not overloaded, so that the bone is maintained over many, many years. Also, when implants were first placed, we treated the upper jaw and lower jaw identical, not taking into account that the bone density and the bone quality in the upper jaw is not the same as the lower. So we can't treat the upper the same as we do the lower. And we talk about the treatment choices and options. You'll see our approach to teeth and implants is different if we're talking about upper jaw versus lower jaw. If we don't do that, we're not going to get the same success after 10, 15, 20 plus years upper and lower jaw. The other thing is we get a much more success with implants than we do with traditional dentistry, with crowns, bridges, and dentures. Root canals. How many people have ever had a root canal and think they've had a root canal once per lifetime, it's done? In fact, a certain percentage, 10, 15, 20% of root canals do get reinfected, sometimes 5, 10, 15, or 20 years later. Crowns. A person with a crown or a denture, crown or a bridge, they may have the crown fracture or the tooth underneath fracture, or tooth gate gum disease, or tooth gate cavity. And 15 to 20% of crowns or bridges after 10 years have failed. They simply fail because they've got cavities, fracture, or gum disease. And same thing, we have the same issue with dentures. So we're getting a much greater success rate with implants than we are with traditional dentistry today. This is maybe a little bit redundant. I may have already mentioned this, but our ability to chew is improved. Our speech is improved because we don't have all this plastic in our mouth. It's not moving around. And oftentimes it's smaller, and the teeth are placed where they need to be for not only function and aesthetics, but also for speech. In some cases, we have implants where the person may still have a denture, but the implants are used to hold the denture in place. And I'll show you in a later video, you'll see some of the clinical slides where a denture can snap in place. So this person still has a denture, but now they have something that is solid. It doesn't move around. And although it's a denture, it has significant improvements compared to just a traditional denture that sits on the gums. It doesn't move around, so they don't get as much food, or no food gets underneath, which is one of the problems with traditional dentures, and improves our ability and confidence when we're chewing and eating and so on. In the upper jaw, if we have these dentures that are attached to implants, we can have an open palate. Traditional dentures have the palate covered, but when we have implants with the denture, this goes in place, and this can be quite small, and the palate is left open, so you can feel the texture and the temperature of foods that you cannot when the roof of the mouth is fully covered. A lot of people have temperature sensitivity with their teeth, especially if the gums are receded, and they think, oh my gosh, if I get implants, these are metal, that's going to transmit temperature, that's going to be even worse. Actually, the opposite is true. There are no nerves attached to the implants, so people can have a full mouth of implants. They can drink as hot or cold as they like. They do not get temperature sensitivity like we do with natural teeth. I've mentioned this briefly. If implants are placed, we can now place the teeth where they need to be, also for aesthetics. That's not necessarily true of dentures. Dentures, sometimes the teeth have to be placed back and up because they need stability and function, more so than aesthetics and phonetics. We can restore a vertical dimension if it's been lost, and we can also provide some soft tissue support. If you watch some of the earlier videos, you saw what happens when we lose our teeth and the whole face starts to cave in. This changes our ability to not only chew and function, it also has implications on how we feel, improves our self-esteem, and it makes us oftentimes look younger because we've got better facial support. One study by Dr. Carl Misch of patients that came into his office, people that came in with dentures to begin with, left with implants, had this to say about their implants. And if you take a look at the comment at the bottom there, 80% of the patients treated with implants said that their overall psychological health was improved. In other words, they felt more confident, their self-esteem was improved because they felt like they were whole again. They had something that was solid. They had some good teeth they could chew with and be confident about. Surgical benefits, I just summarized that in a few things. Number one, we can have immediate implants today. So we can have a tooth removed and an implant put in right away. There's minimal post-op discomfort. People are really surprised. They think, oh my gosh, I've had root canals, I've had gum surgery, I've had wisdom teeth. All those were terribly painful. And I would say that a lot of those on a scale of 1 to 10 would be typically anywhere from a 5, 6, or 7. In some cases, a bad infection can be as much as a 10 out of 10 as far as pain. When we're doing implants, if we follow a certain protocol, people have minimal discomfort. Typically a 2 or 3, maybe a 4 out of 10. In fact, I've had people come into the office, we've placed implants, they've literally gone back to work that same day. Most often I tell people, say, you know what, take a day, just rest, but they can go back to work the next day. Every procedure is a bit different. Placing one implant is quite different than placing 20 in one sitting. And placing implants is different than bone grafting, and plus there's differences from each individual. But overall, I would say our surgical procedures with implant dentistry are well tolerated. We always give pain relievers, typically Tylenol 3 or some type of equivalent, but oftentimes people say, you know what, I didn't even use a prescription, I just took regular Tylenol. Most procedures are done in less than an hour and a half. Treatment that used to take sometimes many months, 6 months, a year, or 2 years or more, oftentimes can be done in less than 4 months. We can do sedation. A lot of times people are nervous at the best of times coming in to have a dental appointment, and as soon as you mention surgery and as soon as you mention implants, their anxiety level goes up even higher. Well, oftentimes we'll do a sedation, the person comes in, they goes to sleep, wakes up, it's all done and it's all over, and they have no recollection of what's been done. I mentioned immediate teeth a couple times. Yes, we can take a tooth out, put an implant in place, and put a tooth on that right away. We just have to be able to control the forces and pressures that are being put on it. And almost all of our procedures are done as an outpatient. In other words, you come into the dental office, you don't have to go to the hospital, just come into the dental office. We can do it with local freezing, we can do it with or without sedation. Basically, you can go home that same day. And so if I can summarize all the benefits that you would receive with dental implants, I can summarize it in 3 words: health, confidence, and smile. Your overall improved health, dental health, improved confidence and self-confidence, your ability to chew and eat and go out in public and eat whatever it is that you like, and also your improved smile.